Welcome to Module 1, Dental Office Emergencies. Spend this week reviewing the syllabus and reviewing the Good Samaritan Law. By the end of the week, you are required to complete the syllabus agreement. This agreement simply states that you have reviewed the syllabus and that you can contact your instructor should you have any questions or concerns of course content. A discussion posting will be due by Wednesday midnight and will be presented at the end of this audio lecture. You are also required to respond to one of your peers' postings by Sunday midnight. I'd like to review a few important aspects about this course. Course evaluation is determined by completing all the assignments, and 75% proficiency is required for passing this course. An incomplete will be given if any of the course assignments have not been completed. It is the responsibility of the student to familiarize themselves with all the course policies, calendar of events, required readings, quizzes, and assignments. Each module has an agenda page. Begin each week by reading these pages. They are the heart of this online course. They include all the necessary information to complete the course requirements and assignments. Please read them carefully and often. They will also provide links to the video lectures, discussion board, quiz bank, assignments, assignment drop boxes, and the exams. There are 4 types of assessment for your course final grade: 2 exams, a midterm and a final, 10 discussion postings with responses, an interactive reflective paper, and a dental office emergency video. Each one of these assignments comes with a rubric to guide you through successful completion. There are 2 exams in this course, a midterm and a final. Each exam will be 50 questions, and these questions will be selected from the quiz bank. You will have 75 minutes to complete each exam, and only 1 attempt is allowed. Each exam will constitute 25% of your final grade. It is required that you pass the final exam with a 75% or higher to successfully complete this course and remain in the dental hygiene program. It is in your best interest to answer the assigned sample questions and prepare for each module as you proceed through the course. Weekly discussion postings and responses are required in 10 of the course modules. 10 initial postings and 10 follow-up responses will be worth 150 points and constitute 15% of your grade. The 50-word minimum of each initial posting and response is intended to restrict the writing of unnecessary content and drive the discussion to depth and provoke subject matter. Posting filled with fluff and responses will be graded harshly, and greetings and salutations do not count to the word count requirements. Failure to participate in 2 of the discussion postings or 2 discussion responses result in your grade being dropped by a letter and may place you on academic warning. Further lack of participation may constitute a D or F in the course and dismissal from the program. Towards the end of this course, we will have an interactive learning experience with the emergency medical students at HCC. This date will be announced later in the course and will require you to attend campus for this one visit. A 100-word reflection will be required following this activity. This paper constitutes 5% of your final grade, and a rubric is provided to help you complete this assignment with success. Each student will be assigned a dental emergency, for which they will role play the emergency with their classmates and to capture the essence of the emergency with video. This video will constitute 20% of the final grade. You will also be required to review 3 of your peers' videos and evaluate them as well. This will constitute 15% of your final grade. The following is a video previously done by dental hygiene students for this assignment.
The first step when treating epistasis is to identify the mechanism of injury and define the severity. This will determine the course of action. The clinician should wear personal protection attire. CAB should be performed to ensure the patient has appropriate circulation and has an open airway and is breathing. Suction may be needed to remove blood from the mouth to maintain an airway. Position the patient upright to have his or her head tilted slightly forward to prevent blood from entering the throat. Have the patient apply direct pressure by pinching the lower part of the nose for at least 15 minutes and up to 20 minutes. Be sure to have the patient breathe through the mouth. Have a basin of some type available so the patient can spit out all blood and saliva. Then place an ice pack over the bridge of the nose. Doing so may help with vasoconstriction. The patient should not blow his or her nose, although doing so may aid in hemostasis. Most nosebleeds will stop with direct pressure. However, if the bleeding does not stop, it could be a more serious condition and the patient should be referred to the emergency department for evaluation and treatment. Treatment that may need to be performed in the emergency department, including cauterizing the area using silver nitrate or packing the nostrils. If sufficient blood loss occurs, the patient may require a blood transfusion, and laboratory tests may be performed to determine the etiology of the epistasis. Stop making a face. It won't
I'm trying to make my nostril bigger. I have little nostrils. Okay. Oh.
Treat me like a jawbreaker.
While reviewing the medical history, Tiffany discovers Felicia has a cardiac pacemaker. Tiffany requests to see the pacemaker ID card Felicia received after surgery. After starting treatment, Tiffany realizes Felicia is growing pale, and Felicia reports feeling lightheaded, dizzy, and weak. Realizing Felicia is experiencing interference with her pacemaker, she determines it is caused by the magnetic headrest. By removing the headrest, Felicia begins to feel better, and Tiffany monitors her vitals. Reflecting back on the emergency situation, Tiffany should have known the magnetic headrest would cause interference with Felicia's pacemaker. Newer pacemakers have a protective shield blocking magnetic waves from causing interference with the pacemaker. Other objects in the dental office that cause interference are ferromagnetic and magnetostrictive scalers and ultrasonic cleaning baths.
Hi, Angela. I will be your clinician for today. Okay, so we'll get started on your cleaning. I'm going to push you back a little bit, okay? So how's your day been?
Great. How about you?
It's been amazing. I got this new Prada purse. I'm so excited. This is for a good deal, too. Alright, so I'm going to open my instruments and we're going to get started. You open them up? I'm gonna just grab a bit of cotton wool, put it in here to make space so I can get it with my instrument. And you're bleeding just a little bit, so I'm going to use. Oh my goodness, Angela, are you okay? Wait. Just try to breathe slowly, just calm. No flickering of the hands, just calm. Okay, you're really good. Alright, lean forward. Okay, so to prevent obstructed airways, two really good things you could do is first, as you saw, I turned my back pull away from my patient while I knew I had just put a cotton wool in her mouth. So maybe you do not want to turn away from your patient. And if you do, just know to keep a constant watch on them. Another technique is you can tie floss to the objects you are sticking in your patient's mouth, just to know you can keep accountability of them and know where they're at. So if they choke on any of them, you know where they're gonna be at all times. There you go. Your hands are so cold. Okay, just get a little pale. No, I don't. I'm not feeling good. No, you have to grasp it in your chest. Need it. Are you feeling any better? Your pulse is good. Did you have your pacemaker installed? When I was 5. Ready? So then you can just grab it here. Get rid of those.
The Good Samaritan Law states that any healthcare provider, including a hospital employee who is providing emergency services, shall not be held liable for any civil damages as a result of providing medical care or treatment, unless such damages result from providing or failing to provide medical care or treatment under circumstances demonstrating a reckless regard for the consequences as to the effect of the health of the other. A copy of this complete law can be found in your syllabus. The following short video will provide more information on the practice of this law.
We have another reason to fear getting involved. Getting involved could mean getting sued. So if you decide to help your fellow man, woman, person, you should know there are legal considerations. The general rule is that you have no obligation to help someone in an emergency. Guy's having a heart attack, you don't care, you walk on. Unless you cause the problem, normally you don't have any legal responsibility. To encourage us to help one another, most states have created what are called Good Samaritan laws. These are laws designed to limit liability for doctors and others that help in emergency situations. A few states, like California, have expanded the law to include folks that give CPR. But if you don't fall in one of these special categories, you could be blamed, you could be sued for negligence if the help you offer does more harm than good. So you've watched a few too many Marcus Welby MDs and you think you can help the victim of a motor vehicle accident. You move the guy and you aggravate existing neck or back injuries. You could be responsible. Now, I'm not trying to talk you out of coming to the rescue, just be smart about it. If you have a CPR or other certification, make sure it's current so that you can take advantage of any state protection. If you can find professional help, do it. And don't get in over your head. The idea is to help the victim. You'll only make things worse if you don't really know what you're doing. And once you decide to help, stay with it until authorities or medical help arrives. The law seems harsh, but it's designed to protect the victim, not punish the Good Samaritan. Remembering this simple idea when you face an emergency situation will give you the legal edge. I'm attorney Michael James Bryant.
Please address the following for your discussion posting this week. Share with your class an event that you may have witnessed or you were involved in dealing with the Good Samaritan law. Did you worry that the assistance provided would cause more damage or have any legal ramifications for those who are assisting in the event? Post your initial response by Wednesday midnight and complete a response to one of your peers by Sunday midnight. This will conclude the audio lecture for the week.